Non-communicable disease such as diabetes, heart disease, and cancer are growing global challenge. But this challenge also presents us with an opportunity.
In WHO, we are really committed to use every tool that is available to address NCDs. That is digital health, but it is also self-care.
We're not just talking about fit, eating correctly, washing your teeth. We're talking also about the tools that are necessary for people to self-care. We're on the verge of almost like a self-care revolution, because these will be accessible, they'll be self-managed, and they will have very high impact.
If you can find ways to improve treatment compliance and provide good information, you're going to improve outcomes.
With digital technologies, we're able to reach a vast mass of people with targeted information.
But the access for information is not enough, so you actually need to understand that information and incorporate that on your routine.
Prevention, not treatment alone, must be the foundation of universal health coverage. We need to empower individuals that are fully supported to care for their own health.
Developers also need to understand that they just can't develop a product and bring it into the market. It's the users, it's the providers. I think they also need to be taken into account. They are the ones who are going to use it. If they are not on board, it's not going to work.
If we provide enough value, people will trust our services.
Digital tools and initiatives like the WHO ITU Be Healthy, Be Mobile campaign can really improve access to self-care and empower people who are living with NCDs to effectively monitor and manage their conditions.
Definitely NCDs are the crisis of our century. And digital health has to play a part, but we have to make sure that these scale-ups are ethical, that they're equitable and safe.
Let's seize this opportunity to close the digital divide, to bring closer to communities, and to ensure everybody has the knowledge and the tools to live longer and healthier lives.